The project I'm working on as part of the team is looking at the cost of care and data mapping associated with violence-related injuries and road traffic crashes. The project attempts an initial part to look at the cost of a number of these people that present to hospitals for treatment and management of their injuries. Working in the intensive care and in the operating theater, I've come across a number of these patients. A couple of case studies we've done. One, a small boy, for example, that had suffered from gunshot wounds and spent several weeks in the intensive care unit. And we did a conservative estimate of what we spent taking care of him, and it's about $4 million just during his hospital stay. So the study's purpose is to get an idea of how much we spend taking care of these patients. Where do these injuries occur? Who are the people most likely to be involved? What time of day do they occur? And once we have a profile of the persons who are likely to be involved and where these things occur, we can create effective intervention strategies. I think a lot of in the media, a lot of the focus is on the importance, for example, of the police being involved in solutions. But perhaps we need to be a bit more involved before this whole process. And there's a growing push to look at this as a public health problem, which it really is, considering the effect that we spend and its effect on the public health system as a whole. For example, developing strategies specific, if we can identify specific roads or roadways that are issues, putting in interventions, police lights, crosswalks to try and stop these accidents happening in the first place. Similarly, if we can identify hotspots where violence is occurring through community-based interventions, some involving the police, some not, we can hope to decrease these injuries or decrease the rate at which these injuries occur in the first place.